you're new here, my name is Sabrina and I'm a first year medical student at the University of Chicago. Today I'm joined by my good friend and classmate Gary.
Hi.
So I've been getting quite a few DMs and comments from premeds and health professional students, med students, aiming to get more involved in policy, wanting to hear more about my experiences in health policy. And so this video will be covering all of that. I'll let Gary introduce himself in a second, but he's also someone that has quite extensive experience in policy, and so I felt he would be a good guest to bring on for this happy hour. As a broad overview for the structure of this video, we're first going to be going over what we did at each stage in our careers, from undergrad to med school to gap years, and our tips and suggestions for students at each of those stages. We'll then talk a little bit about how we hope to incorporate policy into our future careers. Honestly, we're still figuring that out. And finally, we'll end with some Q&A. I put up an Instagram story asking for questions about a week ago, so thank you to everyone who sent in their questions. We'll be answering them at the end of the video. As a last bit of housekeeping, as with all of my happy hour videos, we are drinking a cocktail. I'll include a recipe in the description box as usual, but because physiology is currently killing us, these are virgin, there's no alcohol in them. And this is a more serious topic, so if you want Gary unfiltered, you'll have to comment below.
You'll have to come back.
You'll have to come back another time. Why don't you introduce yourself?
Sure. So, hey everyone again, my name is Gary. I'm a first year medical student at Pritzker, like Sabrina. I went to Duke for undergrad and studied neuroscience and health policy. Did a lot of research at the Health Policy Center at my undergrad, and then for my gap year, I worked at a healthcare startup out in DC working on value-based care.
So we can just quickly move into what we did in undergrad. We both double majored. I also studied neuroscience. My double major was in international affairs. At least for me, I honestly didn't have that much policy experience in undergrad. I was the executive director of the political review at my undergrad, WashU. So I did some writing on health and science for that magazine, and I also was involved in policy writing, communication in that space. I also did an internship at the end of my sophomore year, I think, at a Brookings Institution office doing health econ. I was studying the impacts of the new medical school that was opened at University of Nevada, Las Vegas, on the local economy. It wasn't necessarily health policy in terms of what you might traditionally think of when you think health policy, but it was one of the first instances when I could see that there was work being done combining health systems and econ and all these other things. Yeah.
I definitely didn't come in to undergrad with policy interests. I came in just as an intended neuroscience major. I got involved with a program for my freshman summer that was focused on exploring intersections of science and policy, and got to do a small research project focusing on use of neuroscience claims within the criminal justice system.
That's so cool.
As
culpability.
Yeah, culpability as in defense questions. But I realized because I was pretty sure I was on the pre-med track, I was more interested in applying that kind of lens to more clinical or healthcare questions, and so ended up taking an intro to U.S. healthcare systems course my sophomore fall. Kind of just snowballed from that. Ended up taking more courses, ended up connecting with that professor, and he ended up connecting me with a PI to do research with at the Health Policy Center. Ended up doing an internship at what was called the Center for Personalized Healthcare. And focused on improving the healthcare system to be more proactive and preventive, and improving primary care settings. And then did study abroad in India, which was focused on rural healthcare systems.
Oh, very cool.
Yeah, and gave me more of a global health perspective, and also a public health perspective.
Yeah.
So I think all of those things just grew over time. I kept pursuing things that felt interesting to me. I realized that, lab research wasn't the life for me.
No.
I still knew that I wanted to pursue medicine and take care of patients and be involved with that, but the research questions that I was more interested in was focused on, affordability and access to care and sort of your more typical macro level systems questions. And so then ended up doing my thesis research kind of through the pub pol department and doing it with my PI at the Health Policy Center.
And he's published now. He has a first author paper.
Yay!
I feel like I was a lot less intentional kind of going into college of what I wanted to do. I think I was just not sure about what I wanted to do. I obviously was really interested in medicine, have been interested in medicine for a really long time, but I was entertaining law school and like just doing policy. I was like thinking about doing other things, and so it's cool to see that like your interest in policy kind of naturally came from like your experiences and snowballed and complemented your interest in medicine. Yeah,
definitely.
Whereas I think for me, like I just was interested in policy and medicine. Spent all of my college career really trying to find ways to combine those two together, and health policy became like the natural way to combine those things. A lot of my experiences, whether it's like my double major or I studied abroad in Switzerland doing international diplomacy, like not at all related to like domestic health policy. I feel like my experiences are quite a bit more scattered, just by virtue of the fact that I didn't come in with a clear idea of what I wanted to do. But I'm still here, and I'm still really like grateful for all of the experiences. I think they were really educational. And my tip for undergrad students is to not necessarily be afraid to invest in your interests, even if you might not know how things might hang together in your career. And really thought that I made the most of my college experience, and not everything necessarily needs to make sense with your narrative. Of course, it's like good to think about that, but your resume shouldn't be what's dictating like every step you take. You should also feel free to invest in things that you just find interesting just because they're interesting.
Yeah, the narrative that I just shared is like super clean and like
it's the one that you share with like future employers.
Yeah, it's the one that you like put on your applications and like everything just like makes sense. But no, definitely like there was a lot of soul searching, and a lot of it is just trial and error. And like if you sort of like what you were just saying, if you just like abide by the philosophy of like doing things that are interesting to you, investing in things that you're passionate about, like that story or like that narrative will sort of like naturally come together later on, or you'll be able to see how you did one experience and you're like, oh, I didn't really like that, but that showed me that I wanted to do something else. Or it just shapes like how you see things and how you understand like what you're passionate about. So like definitely like take the space to like do whatever is like interesting to you. The other tip that I would add to like what Serena was saying before is search out your own opportunities. Like a lot of professors aren't gonna like actively advertise that they're like looking for a research assistant, or they might not even be thinking of like getting an extra research assistant at the time. But if you kind of come along and show that you have some relevant interest or experience, they might be like, yeah, it'd be great to plug you into a project. Don't be afraid to just like reach out to people and set up just informational conversations just to like learn about what they're doing. And even if like the timing's not right for you to get involved with something
it's a
connection, and you're just you're kind of building that relationship so that the next time that something comes along, like they'll think, oh yeah, I met Sabrina, like maybe she'd be a good fit for this.
Definitely.
So definitely like be thinking about sort of the relationships you're cultivating as well.
Right, and I think that is also really important, like thinking about relationships, networking, all of that is especially important if you're a pre-med that's also interested in policy, because it's a little bit more of an unconventional path. And so like I think you can feel really lonely at times when you're surrounded by pre-meds that are like, I'm so passionate about basic science. And like
but they're like not actually passionate.
Yeah, I feel like are there actually people passionate about basic science? I'm not sure. No. we need you. But
deep respect to the people
that I could never do it. I think it can feel really lonely, and having those mentors and those role models, whether they're 10 years, 20 years older than you, or whether they're just like a few years older than you, is really, really important.
Yeah, that's actually a really good point, because like I think so much of my perspective and sort of understanding of like the healthcare system came from my mentors who are like midway through their career. They're like very accomplished physicians in their own right, but also were like doing research or had worked in government or had stints in private sector as well. The way that they approached conversations and in their mentorship towards me really helped me kind of like accelerate my growth in this area. So that's another like really good tip, is just to figure out like who can you find as a mentor, and like even better than a mentor, like a sponsor, like someone
Right.
who's going to be really invested in
Who will
your
advocate for
personal
you.
growth
Mhm.
and advocate for you and try to get you more opportunity.
I would say my gap year position was the first time that I had really extensive experience in health policy, specifically domestic health policy. I worked as a research assistant for a government contractor. It was a contract research organization. My clients included the federal government, Centers for Medicare and Medicaid Services, also known as CMS. But I also had clients like the Robert Wood Johnson Foundation, the California Healthcare Foundation. It was definitely a real learning experience for me, given that I was coming into the job with less health policy experience. I was also one of the only premeds in my position. I think there were only 2 premeds in my whole department, and there were multiple hundreds of people in my department. That year doing this research really gave me a wonderful crash course on what domestic health policy will look like.
For my gap year, I worked at a healthcare startup out in DC.
Fun fact, we were actually both in DC, and
Yeah.
then we both came to Chicago, so that was the reason we first bonded. It was so funny because when we met during orientation, it was really like all the little policy kids.
Yeah.
Sorry, I interrupted.
No, you're good.
You were in DC.
So I was in DC, the company specifically focused on supporting independent primary care practices in kind of joining value-based contracts and really practicing value-based care. It was a really interesting and awesome experience because it enabled me to sort of step outside of academia for a year, get a sense of not only what does it mean to live in the real world, but also what does an actual company look like? How does that differ from the type of work or perspectives you get in academia and research, and also just meet a lot of amazing physicians and non-physicians that are working to improve healthcare. And so just kind of expanding that kind of perspective of healthcare ecosystem.
I would agree. I think both of the companies that we worked at are not necessarily what premeds or undergrads are thinking about when they think about the healthcare system. There's so many actors that are kind of behind the scenes that are playing a role. I think when you're thinking about choosing a gap year job, you should reflect on what kind of position you want to hold. If you want to be more in advocacy, then apply for something like Families USA, for instance. Or if you want to be kind of doing what I did, which was supporting state and federal government agencies administering Medicare and Medicaid, then apply for a federal government contractor. And that can mean consulting like Deloitte, BCG, I don't know, I didn't work for those companies, but that's also a way for you to get involved in healthcare. And then obviously there are so many kind of healthcare startups and healthcare companies that are trying to redesign care, like Gary's company. You can find spaces like that too that will also give you a different perspective. Just to kind of compare and contrast for you what we did day to day. As I mentioned, I was a research assistant, so a lot of my tasks were research related. I did a lot of literature reviews, data analysis. I learned new research methods and techniques. For example, one of the things that I learned was qualitative interview coding in vivo. And then, on the other end of the spectrum, from literature review to data analysis and data collection to writing things up, I also had a role in putting together policy briefs for dissemination by CMS and putting together deliverables for state clients. One of my favorite projects was working directly with Iowa Medicaid on implementing value-based care in their state. And so we were on calls with the Iowa Medicaid director and even though I was right out of college, I was able to really support that team and delivering high quality technical assistance, delivering materials that would help answer their questions about how to advance and transform care practice in their state. But yeah, my work was very research related, for better or for worse. I spent a lot of time in my cubicle and meetings. The federal government is very bureaucratic, and so a lot of my work felt bureaucratic at times. One of the cons, I think, of working for a federal government contractor, or it was a con for me, it might not be a con for you.
Kind of interesting to compare those in that since I was working in a company, it was just more operational. We had around 25 or 26 states that we were operating in and supporting these different accountable care organizations or ACOs in these different states. My team really focused on implementation of different initiatives that were coming from our product and tech teams and rolling those out to our field teams, evaluating those efforts, and sort of like continuously monitoring practice satisfaction with our company services, and figuring out like kind of what their areas of needs were, and like trying to like bring those back to the team in DC. Sort of a subset of that for me was specifically focusing on our work with federally qualified health centers, or FQHCs, and kind of figuring out how do we make value-based care work for them, because they have a very different kind of payment model and set of incentives than like privately owned practices. So it was a lot more sort of like operational. It was doing like running reports and doing some basic data analyses, meeting with practice owners and physicians and care managers at different practices, meeting internally within the company with our like business intelligence teams or our tech teams. It was a really good kind of like analyst experience, and helped me just to gain a better sense into a different aspect of healthcare, which is like the private practice side of the world, which is like not often talked about within like academic medical centers, specifically because we were focusing on like private primary care practices, particularly in like more rural areas. Like these are practices that are like the bedrock of like healthcare for these communities.
100%. Yeah, I think we can also go over a little bit what we were looking for when we were doing job searching, how we found the job, things like that. I
think for me the first thing was that I personally didn't want to do research during my gap year. I was pretty set on doing one gap year, although like it's definitely becoming like more and more common to do like 2 or even more. So
a third of our class took 2 or more, and a third took 1 gap year, so it's like even split.
So I was doing like a pretty broad, or casting a pretty broad net: consulting, like healthcare systems, startups, kind of like anything that I could find that seemed like it would give me some more kind of on the ground or like operational experience within the healthcare system. And I actually stumbled upon the startup that I ended up working at because the director of our health policy center was like on their board of directors.
Oh yeah, so those connections, they come back.
He didn't help me get the job. So
just to be clear,
there was like no nepotism there. But it was like a cool connection. And like my research had really focused on value-based care, and so it seemed like a really good fit in terms of getting that kind of outside experience, but also doing work that I was really interested in. Another thing that I'll just like throw out there is like the job market is tough.
It's hard. It's so hard.
Even if you're not like a pre-med looking for a gap year job, you're just like a regular like college grad looking for a job.
I'm sure it's harder now with COVID. Like it's tough.
100%. So you have to kind of throw a lot of things against the wall and just see what sticks. And I think I sent out like 10 applications and got like interviews for like 2 things, and like the company I ended up working at is like the only one where I actually really got to like multiple stages of interviewing, and it just ended up working. It's awesome if you find something that seems like a perfect opportunity and it works out, but also like if it doesn't work out and you end up getting something that you initially didn't really like consider, it might also just like turn into an amazing opportunity.
You never know.
And like you can always kind of like shape it into whatever you want.
Exactly. Yeah, the job market is hard. I applied to 30 jobs before I got my first acceptance. I was deciding between 2 positions at the end of the day, but it was brutal. I also cast a really wide net with what I was looking for. I think similar to you, I wanted something that was going to give me like on the ground health policy experience. I didn't want to do the traditional pre-med gap year jobs like scribing or doing research at like a university. Even if it was health policy research, I kind of wanted to get out of academia. I applied to, think tanks, like other research organizations, and I cast a wide net in terms of topic as well. Given that I had global health experience, I did some like nonprofit global health jobs. Ultimately, the positions I was deciding between were the position that I took in domestic health policy and a position at a think tank in DC in global health security. But I decided to go with the position I actually took because I wanted to get more I wanted to learn, about the U.S. healthcare system.
Yeah.
And the other position also was just a little bit less convenient. It was like a shorter term, wasn't guaranteed that I was going to stay for the foreseeable future.
In terms of like when you're actually like figuring out what jobs to apply for, and then ultimately like what to accept, something that we both found really important was like the flexibility of the job, because like particularly if you're going to be working while you're applying and interviewing, like
you're going to be like taking days off to interview, and like
yeah.
you're going to have that terrible month of July where you're going to do all of your secondaries,
Yeah.
and like you're still going to have to work full time. It's tough, and like you need to be able to balance that.
Yeah, which is why I personally found it helpful to be in a space where there were like a lot of MDs and like a lot of physicians, because they kind of understood and even like supported me while I was applying. But I know like there are a lot of workplaces that aren't necessarily like that, and like don't necessarily like people taking a lot of time off. Yeah. Hopefully you can find a manager, and hopefully even a company that kind of supports you in your journey.
I kind of had a different experience in that I was one of the only pre-meds in my workplace. All of the people working in my workplace either had PhDs in health policy or public policy, or MPHs or Masters in Public Policy degrees. I was really fortunate in that my workplace is really friendly and had a very generous kind of PTO, paid time off, like leave policy. My workplace, even though there weren't as many like pre-meds, there were a lot of people who were applying to grad school, mostly MPH, MPP programs. So it wasn't like unheard of that workers would be trying to get back into school and applying and interviewing and things like that. I am happy to do a video on applying to jobs, reviewing cover letters, interviewing, things like that. If that's something that people would be interested in, like leave a comment below. I think another thing to think about when you're a pre-med looking for a job in health policy is to recognize that, for you it might be like just a gap year, and but the employers are not necessarily thinking about it that way.
Employers don't see themselves as gap year employers.
Yeah.
They are normal companies or firms or whatever that are looking for just full-time hires. Kind of treat the process like that, and like you are applying for a job, you are going into the workforce, and you might have specific goals, but you also need to be able to kind of
meet their goals
and kind of present a case for why it would be mutually beneficial for both you and the company, for you to get hired.
You're also likely going to be competing with people who aren't pre-med, who didn't spend most of their time in undergrad doing science. The people that I worked with were people who studied health policy full time. And so I had to be able to point to some of my previous experiences, including my internships, including my involvement in the political review, and all of the other things that I did in undergrad, to say and prove that I was qualified and that I was able to take this job on effectively. There are a few kind of students that I've advised who are interested in health policy, but maybe don't have that much experience from college. And my advice to them is to always get something on your resume before you apply, because you will be competing with some people who have specific experience within the field that you are applying into. Moving on to what we've been doing in med school, Gary and I actually co-lead the health policy interest group here. So we do quite a bit of work for that. We publish a journal, Student Perspectives on Health Policy Issues. We also host events. So Gary moderated a panel this past week with a few speakers covering what health policy will look like under the Biden administration. Super cool event. He did a great job.
Also, Sabrina is the only one that's really like doing the journal stuff, so she's been doing an amazing job with that.
The editorial experience from undergrad. In addition to that, I also have like another involvement related to kind of editorial things. So I'm a senior op-ed editor for the Chicago Policy Review, which is the student publication of the Harris School of Public Policy here at UChicago. I am the only med student that is on their executive team. So I don't think it's unreasonable to necessarily look outside of the med school if you're looking for opportunities. I actually am still working part-time at my gap year job, staff on a few projects, one evaluation for the Robert Wood Johnson Foundation and one kind of internal Medicaid value-based payment newsletter. It's a full plate, I would say.
She's staying busy for
yeah.
sure. Related to health policy, like doing the health policy interest group, I'm also involved with an initiative called Choosing Wisely, which is like a national initiative that actually started in Canada but has kind of filtered down to the US, focused on like dissemination of high value care and particularly like reducing wasteful spending and reducing like low value care. I'm also on the board of one of our free clinics called Community Health Clinic. And so I'm their kind of like EMR, one of their EMR/quality improvement coordinators. Just kind of gives you a sense of all the different things that you can dive into like really quickly.
Yeah, and I think again it's like showing that there is a place for premeds that are interested in these larger social and structural questions. Like there's a lot of ways to invest in those interests, and even in med school. In terms of like our tips on how to get involved in policy as a med student, I do think our experience is rather limited because, as Harry said, we've only been med students for 6 months. But my first piece of advice would be, as I mentioned earlier, to not be afraid to look outside of the med school for opportunities. Be creative, seek out those opportunities for yourself. The second piece of advice that we kind of discussed, if you have the ability to, you should definitely choose a med school that seems to have the resources and programs that are geared towards health policy and geared towards these interests. We both chose UChicago in part because it seemed to have like a lot of resources towards health policy, emphasized interdisciplinary learning. There seemed to be a lot of integration between the medical school and like other schools on campus. Location in the South Side, gives lots of opportunities for serving the community around us.
An important point is that like health policy can be as broad or as narrow as like you define it to be. Say your school doesn't have like a policy school or like doesn't have a dedicated like health policy department or something. Like maybe there's like a public health department, or there's like a biostats department, but they're doing something like of relevance to kind of health policy. I think there are all these different kind of entry points to do things that are relevant to like health outcomes and health disparities. Even if you're not interested in, or there's not an opportunity to like dive deep into like your state's Medicaid policy or something,
that's
like
not the limit to what
right,
health policy
like
is.
You can do anything that is of interest and importance to you and sort of how you want to see the healthcare system improved, and that can be as micro as you want, like an intervention within a single clinic within your health system, or as macro as like state and federal level policy. So like there really are kind of opportunities wherever you look. It's just kind of how you define those and what's interesting to you.
For sure. Well, I think we can move on to our last section before Q&A, which is how we're thinking about incorporating policy into our future careers. And this is something that we're just continuing to negotiate. We actually, right before we started filming the video, had a very long conversation about dual degrees. So whatever we say here, I don't know, may or may not stick, we'll see. But as of now, I think in terms of specialty interest, I'm interested in surgery, which is not something that is the most easily integrated with policy. There's not necessarily that many people that are working on issues of equity and policy who are also surgeons. So, we'll see how that goes. I am like incorporating and considering my policy interests when I'm thinking about my specialty interests. So, I feel like something like neurosurgery will probably not be compatible with policy. Not that I'm necessarily super interested in neurosurgery, but I am taking into it account. But I also don't want my specialty interest to be fully dictated by the fact that I'm interested in policy.
Regardless of what specialty you choose, it's just becoming more and more clear that you can kind of like shape it into like whatever you want.
It's true.
If you're like interested in like ENT and like you don't necessarily see like a super visible like policy leader in ENT, it doesn't mean that like that path can't be like carved out by you.
That's what I'm telling myself, like that path can be carved by me. It's never been done before.
That's what the people keep telling me, so that's what I'm gonna tell myself.
As for kind of short-term career goals, I do want to do a dual degree. I'm most interested in doing a master's in public policy, either between third and fourth year of med school, which is a fairly common practice. But I know that a lot of surgery residencies also have built-in research years where you can go and do a master's degree at another institution even. So that's also something that I'm considering.
I'm more interested in a more kind of traditional route. Like I'm more interested in internal medicine, also interested in primary care, and being able to tie that in with kind of systems level work or policy level work. And so for me, also not really sure what specifically that's going to look like, but also interested in a dual degree. I'm thinking between an MBA and an MPP, and then kind of leveraging my experiences both as a future physician, but also someone that's interested in policy, potentially working in the public sector or the private sector. I personally don't really see myself pursuing like a research career, and so that's also sort of an important like branch point in terms of like thinking about potential career paths. More and more we're seeing like people go down those routes, and like I think there are plenty of kind of role models or like potential mentors out there that are going down those routes.
Yeah, that's the thing that gives me comfort, like the fact that I might not know exactly how my career will look, but I know that it can be done. There's so many roles for physicians within like state Medicaid agencies, within the federal government, lots of MDs that you worked with at your startup that are working in kind of private sector roles, MDs that are maybe studying health policy or research in health policy, but they primarily operate within an academic medicine setting, which is a much more traditional path. I feel like this video is going to be really long, so we'll try to breeze through this Q&A. First question that we received was how to get involved in health policy during undergrad. I think we kind of covered a lot of different ways that you can get involved. Both of us did research. We got involved in extracurricular kind of groups on campus that were working in health policy. I think one other really important thing is even if there's not necessarily a formalized program or class or anything like that that's on health policy, definitely read up on things yourself, like learn about the system, and like then you'll slowly start to see more opportunities of places where a pre-med or undergrad student can fit in. The second question that we got was, are there any big names in the field that you recommend checking out? Great question, sent to me by my roommate. Thank you, Naomi.
Twitter is a great place to kind of stay up to date with things that are happening, kind of stay up to date with the discussions and controversies and new things that are happening within different fields. And I would caution that sometimes it can be a little bit of an echo chamber, and sometimes can be a little distorted from reality.
Sometimes you need to log off.
It can definitely become a rabbit hole, but it is a good kind of source of kind of up-to-date news and reactions. So, I mean, there's so many people to follow, but I think a couple people that I can think of, like Ashish Jha, who is now Dean of the Brown School of Public Health.
Yeah.
He's just a great kind of like grounded voice in public health, and certainly during COVID. Andy Slavitt has more of a kind of government public sector voice.
I'd also offer healthcare journalists like Sarah Cliff is really great. Elizabeth Rosenthal, I think she's with Kaiser Health News. The other thing to kind of note when you're following different people on Twitter is that, like health policy isn't a homogenous field. Like there are people who have different perspectives on what we should be doing as a country, what we should be doing, on the more localized level. Don't just like absorb everything. Like read things critically and find out what you believe. Like you might be someone who advocates for single payer once you've like thought things through, and not everybody in the health policy space does that. There are more conservative voices, there are more liberal voices, and even though like you might not resonate with everybody, it is kind of helpful to learn about all the perspectives that are being offered, even if just to kind of strengthen your own perspective.
And like very well informed, very well educated people can like disagree very like reasonably on different issues, and so it's kind of interesting to follow different threads and discussions of very prominent academics that are like publicly disagreeing about something, and hopefully modeling like good civil discourse, but also just kind of showing that data doesn't necessarily just have one interpretation.
If we think of some more names, because I think we both had a little trouble pulling some of them off the top of our head, I'll add names in the description box. The next question that we got is internships and part-time jobs that you can do in medical school. I can start with this considering I am doing a part-time job during med school. I know that it's not super common for people to work part-time during med school, and what I would say is like there's a big caveat that like you are a student first, like you are paying an exorbitantly high tuition to learn to be a doctor, and that is always going to be your first priority. You know, I think I have like somewhat of a unique case in that I worked at a job during my gap year, and they allowed me to stay and do part-time work and stay on a few projects. And given that, you know, they already knew me, it's been a fairly easy transition. They know that they can trust me. They know that I'm going to get my work done when I say that I'm going to get it done. Because of that level of trust, my job is also fairly flexible. I don't have to work like a set amount of hours each week. I honestly think it would be a little bit of a struggle to have to work like 10 hours a week, just given that, you know, it is quite demanding. When you're looking for positions, I think you should first just really be honest about like what you really have the capacity to do.
I'm personally not doing anything like external to Pritzker right now, but certainly have met like other students who have done things like as much as like a 20-hour per week like part-time internship during med school. And this is also going to be really dependent on how your curriculum is set up. Like Pritzker, we still have a 2-year preclinical, so it's a little bit more spaced out. If you had a 1-year preclinical, it might be a little bit more difficult to fit in that extra time. There.
And he worked at a healthcare startup.
Yeah, he worked at a healthcare startup. It's definitely possible to get involved with part-time internships, and you just have to make sure that you're balancing all your commitments and still being able to kind of fulfill all your academic requirements.
Right. We do want to dispel the myth that it's impossible. It's not like our admin is telling us, oh, you absolutely cannot work or anything like that. But it is, you know, a challenge. We'll probably have to do quite a bit of like DIY searching for a position that would be flexible enough to accommodate your school schedule, while also like adding value to your day.
And it's okay to be, you know, choosy with, you know,
with your time.
Time
it's
and
limited.
opportunity.
It's very limited. The next question is, what should I do as a high schooler entering pre-med in the fall? I think that like people's interests really change in college, and they really morph. And as I mentioned, you know, I didn't go into college with a very clear idea of necessarily what I wanted to do for my job. You know, as an intern pre-med, like definitely do all of the prerequisites, like set yourself up for success, like sign up for Gen Chem. But if you're not feeling it, you don't have to stick with pre-med. Please actually like explore your interests. Don't like feel like you're stuck in this rigid idea of what you want to accomplish in college.
Yeah, no, I definitely agree. And if you do, you know, sort of already have this kind of budding sense of like what you're interested in, and like you really do want to explore these things, like that's also amazing. And you know, I would just encourage you to just dive right in, like once you get into college, and like just really immerse yourself in coursework and extracurriculars, research. You know, take advantage of speakers that come to campus.
That's a big thing. Like there are all of these kind of educational opportunities outside of like your coursework that I think people don't necessarily always take advantage of. Like there are speakers, there are events, there are workshops that are being done, and just kind of keeping an eye out for things that might expand your perspective a little more. We have a few questions about book recommendations. We talked about this. We actually don't read that many books.
When I find the time to do some, you know, reading, I try to do like fiction or something that's not like so fact oriented.
But I will say that I really like An American Sickness by Elizabeth Rosenthal. It's a really good kind of breakdown of the various actors in U.S. health policy. It's a good introduction, I think, to the various issues that we're facing. Beyond that, I think we would just recommend reading Kaiser Family Foundation, Kaiser Health News, Commonwealth Fund, Milbank Memorial Fund, Academy Health sometimes has good blog posts, Health Affairs, all of these kind of websites.
And if you're looking for sort of more like long form, like narrative pieces, like The New Yorker, like always has great pieces. Like Atul Gawande has like written some really great pieces there. Ed Young at The Atlantic does some really like awesome investigative journalism around.
James Hamblin is also an MD at The Atlantic.
So a lot of great journalists that do really exceptional work as well. Also, a good way to just like keep up to date with these is just to sign up for like the morning or weekly newsletters that a lot of these publications have.
Well, thank you so much for joining us for such a long period of time. I really hope this video was informative. I would have killed for a video like this when I was like a lost little pre-med in college, so like so happy to put out this kind of content. Leave me a comment, let me know what else you want to see. Yeah, thank you so much. See you guys later. See you next time.